If you are over 60 and you have been noticing that your skin has been doing something strange lately, maybe it itches for no reason, or it looks more yellow than it used to, or there are dark patches showing up in places you have never seen before, I need you to stop whatever you are doing right now and watch this video all the way through. Because what most people do not know, and what I am going to share with you in the next few minutes, is that your skin is not just the outer layer of your body. It is a mirror, and right now it may be showing you something that your kidneys are desperately trying to communicate. Something that if you ignore it, could cost you years of your life. Here is the terrifying truth that most doctors do not take the time to explain. Your kidneys can lose up to 90% of their function before you feel a single symptom. No pain, no alarm, no obvious warning, just a slow, invisible decline happening inside your body every single day. And by the time most people find out their kidneys are in serious trouble, the damage has already been building for months, sometimes years. But here is what gives me hope and what I want you to hold on to as you watch this video. The body is not silent, it sends signals. And 4 of the most powerful signals your kidneys send when they are struggling show up not in your blood tests, not in your urine, but right there on the surface of your skin. Signals that most people over 60 dismiss as normal aging. Signals that most doctors, unless they are kidney specialists, do not connect to the kidneys at all. My name is Ethan Miller, and I have spent years sitting across from patients who came to me confused, scared, and asking the same question. Doctor, why did nobody tell me sooner? Today, I am telling you sooner. Stay with me through all 4 signs, because sign number 3 is the one that shocks people the most, and sign number 4 is the one that almost everyone gets completely wrong. Before I give you the 4 signs, I need to give you 60 seconds of science because I want you to understand the why behind everything we are going to discuss today. This is not about scaring you. This is about arming you with real knowledge. Your kidneys are 2 fist-sized organs sitting just below your rib cage, one on each side of your spine. Every single minute of every single day, they filter approximately 1.5 liters of blood. That is about 2,000 liters of blood filtered every 24 hours without rest. Their job is to pull out waste products, excess fluids, toxins, and harmful substances, and send them out of the body through urine. When the kidneys are healthy, this happens silently and perfectly. But when the kidneys start to decline, whether from diabetes, high blood pressure, aging, inflammation, or chronic dehydration, waste products that should be leaving the body start to accumulate in the blood instead. These waste products are called uremic toxins. And uric toxins do not stay politely in one place. They travel. They reach every organ, they reach every tissue, and they reach your skin. The medical term for the skin changes caused by kidney disease is uremic dermopathy. It is a recognized clinical phenomenon documented in nephrology literature and confirmed in thousands of patient cases. And yet most people sitting in their living rooms looking at their own skin have never heard that term in their lives. That ends today. I want to tell you about Margaret. Margaret was 64 years old, a retired school teacher from Ohio. She was the kind of woman who took care of everyone else, her grandchildren, her husband, her neighbors, and rarely thought about her own health unless something forced her to. About 2 years before she came to see a kidney specialist, Margaret started noticing that her skin was itchy. Not the kind of itch you get from dry winter air or a new laundry detergent. This was a deep itch, a persistent itch that did not go away no matter how much lotion she put on. She scratched so much at night that she started leaving marks on her arms and legs. She mentioned it to her primary care doctor, who told her it was probably eczema or contact dermatitis. She was given a prescription hydrocortisone cream. The cream helped a little, but the itch always came back. For 2 years, Margaret treated her skin. 2 years. And during those 2 years, her kidneys were silently declining. When she finally went to a nephrologist, a kidney specialist, after a routine blood test flagged an elevated creatinine level, the doctor took one look at her scratched arms and said, "How long has your skin been doing this?" Margaret said, 2 years. The doctor sat back and said, "Your skin has been telling you about your kidneys for 2 years. By that point, Margaret was in stage 3 chronic kidney disease. Her GFR, that is the measurement of how well her kidneys are filtering, was 52. Normal is above 90. She had lost lost nearly half her kidney function, and her skin had been screaming about it the entire time. I share Margaret's story not to frighten you, but because her story is not unusual. In my experience working with kidney patients, the skin signs come first, always. The question is whether anyone is paying attention. Let us get into the 4 signs. I want you to think of each one as a message. A message from your kidneys written on your skin, waiting for someone to read it. Warning sign number 1, persistent itching with no rash. This is the most common skin sign of kidney disease, and it is called uremic pruritus in medical terminology. Pruritus is simply the medical word for itching, and uremic means related to the buildup of ura and other waste products in the blood. The kind of waste buildup that happens when kidneys are not filtering properly. Here is what makes this itch different from ordinary dry skin or an allergic reaction. Ordinary itching has a source you can identify: a bug bite, a rash, a new soap. Uremic pruritus has no visible source at all. The skin looks normal. There is no rash, there is no redness, there is nothing to see. There is only the itch. A deep, maddening, relentless itch that often gets worse at night, often affects the back, the arms, and the legs, and does not respond to antihistamines or topical creams the way a normal itch would. The mechanism behind this is complex, but here is the simplified version. When the kidneys cannot properly filter the blood, certain substances accumulate. One of them is a compound called beta-2 microlobulin. Another is ura itself. These substances irritate the peripheral nerve endings in the skin. They also trigger the release of inflammatory chemicals called cytokines, which activate itch-sensing nerve fibers. The result is an itch that comes from the inside out, not from the outside in. No amount of cream applied to the surface will fix a problem originating in the blood. A study published in the Journal of the American Society of Nephrology found that uremic pruritus affects between 40 and 50% of patients with chronic kidney disease. That is nearly 1 in 2. And yet, in clinical surveys, the majority of those patients reported that their doctors attributed the itching to other causes, most commonly dry skin or eczema, before the kidney connection was made. What you should do if you recognize this signus sterisk: do not reach for another tube of cortisone cream. Reach for your phone and call your doctor. Ask specifically for a comprehensive metabolic panel and a GFR test. Tell your doctor you want your kidney function evaluated. Use those exact words. You have the right to ask for that test. And if you have been itching for more than 4 weeks with no clear cause, that request is not only reasonable, it is necessary. One more thing I need to say about this sign. People over 60 often assume that new symptoms are just part of getting older. I understand that instinct, but I want to push back on it gently. Persistent itching is not a normal part of aging. It deserves investigation. Margaret waited 2 years. You do not have to. Warning sign number 2, unusual skin color changes, palar, yellowish tone, or a grayish APARANCES. Your skin color tells your doctor an enormous amount about what is happening inside your body. And when the kidneys are in trouble, the color of your skin changes in very specific ways that are different from the changes caused by anemia alone, or liver problems alone, or sun damage. Let me explain the 3 color changes associated with kidney disease and why each one happens. The first is palar, an unusual paleness of the skin, particularly noticeable in the face, the gums, and the inner lower eyelid. When you gently pull down your lower eyelid and look inside, healthy tissue should be pink and vibrant. In someone whose kidneys are declining, that tissue looks pale pink, almost white. This happens because damaged kidneys produce less of a hormone called erythropoietin, abbreviated EPO. Erythropoietin is the signal the kidneys send to the bone marrow, telling it to produce red blood cells. When EPO production drops, the bone marrow makes fewer red blood cells. Fewer red blood cells means anemia, and anemia means palar. The second color change is a yellowish or salo tone to the skin. This is caused by the accumulation of a pigment called urochrome, a yellow-colored waste product that healthy kidneys filter out through urine. When the kidneys are struggling, urochrome accumulates in the blood and deposits itself into the skin. It gives the complexion a dull, washed-out, slightly yellow cast that is different from the more intense yellow of jaundice caused by liver disease. Urochrome-related yellowing is subtle enough that many people assume it is just tiredness or poor lighting. But if you look at photos of yourself from 5 years ago and compare them to how your skin looks today, and something seems dull or different in a way you cannot explain, that subtle shift is worth paying attention to. The third color change is perhaps the most striking and the least well known. It is a grayish or brownish discoloration, sometimes described by patients as looking ashen or as if the skin has lost its vitality entirely. This happens due to the combination of urochrome accumulation and a reduction in melanin regulation that can occur as uremic toxins interfere with normal cellular processes in the skin. I had a patient, a 61-year-old gentleman named Robert, a former construction worker from Texas, who came to see me at his wife's insistence. She had been telling him for 6 months that he looked gray. He dismissed it. She finally made the appointment herself. His GFR at that first visit was 38, stage 3B, chronic kidney disease. He had no idea. His wife's observation, "He looks gray," was the thing that got him through the door. If someone who loves you has commented that you look different lately, pale, yellow, gray, dull, please do not brush it off. The people who see us every day often notice changes that we ourselves stop seeing because we look in the mirror every morning and adjust to gradual shifts. Trust the observations of the people around you. Before we get to signs 3 and 4, and I promise you, these are the two that are going to surprise you most, I want to ask you something. If this video has already shown you something you did not know, if you have learned something that feels important and true, please tap the like button right now. I mean that sincerely. Not because I need the numbers, but because when you press that button, YouTube shows this video to other men and women over 60 who are experiencing these exact symptoms right now and do not know what they mean. Your one tap could reach someone tonight who has been itching for 2 years and never connected it to their kidneys. That matters more than you know. And if you have not subscribed yet, please do that right now and turn on the notification bell. Every week, I release videos like this one. Practical science, grounded medical information for people who deserve to understand what is happening inside their own bodies. Now, down in the comments, tell me, have you or someone you love noticed any skin changes recently that you could not explain? I read every comment. Your question might become someone else's answer. Warning sign number 3, dark patches on the skin, a condition called uremic. Melanosis. I told you this one would surprise you. And the reason it surprises people is that dark patches on the skin have so many possible causes. Sun damage, age spots, hormonal changes, medication side effects that almost nobody thinks to connect them to the kidneys. But there is a specific pattern of dark patches associated with kidney disease. And it looks different from an ordinary age spot. Here's the science behind it. The kidneys play a surprisingly important role in regulating melanin, the pigment that gives skin its color. When uric toxins accumulate in the blood, they interfere with the normal activity of melanocytes, the cells in the skin responsible for producing melanin. The result is patches of hyperpigmentation, areas where melanin is produced in excess and deposits into the skin unevenly. The pattern of uric melanosis tends to appear in specific locations. It is commonly found on the face, particularly around the eyes and on the forehead. It appears on the forearms and the backs of the hands, can show up on the shins and the tops of the feet. And critically, it tends to be diffuse rather than sharply defined, meaning the edges of the darkened areas are blurred and gradual rather than crisp and clear like a typical age spot. A research study published in the International Journal of Dermatology examined skin changes in chronic kidney disease patients and found that hyperpigmentation was present in a significant percentage of patients at all stages of the disease, including early stages where most patients had no other symptoms they were aware of. But here is the detail I want you to remember most. The color of uremic melanosis tends to be a brownish gray or brownish black, and it often gives the skin a dirty appearance. Patients sometimes describe it as looking like they have not washed properly, or like there is a shadow under the skin that does not wash off. That specific quality, a dullness or shadow that seems to come from inside the skin rather than from the surface, is the distinguishing feature. I want to tell you about a woman named Dorothy. Dorothy was 67 years old and had been seeing a dermatologist for 2 years about darkening patches on her forearms and the backs of her hands. She had tried prescription brightening creams. She had tried laser treatments. Nothing worked. The patches were not fading. If anything, they were spreading. Her dermatologist eventually referred her not to a nephrologist, but to an endocrinologist, thinking it might be a hormonal issue. The endocrinologist was thorough and ordered a comprehensive blood panel. Her creatinine came back at 2.1. Her GFR was 31. She was in stage 3B, nearly stage 4 kidney disease. The patches on her skin that 2 years of dermatological treatment had failed to address were not a skin problem at all. They were a kidney problem wearing a skin disguise. Dorothy told me that moment was the strangest combination of terror and relief she had ever experienced. Terror because of the diagnosis. Relief because finally after 2 years she had an answer. And an answer means a path forward. Warning sign number 4. Dry, cracked skin that does not respond to MOIS Turi's, or asterisk asterisk. Now I know what you were thinking. Dry skin? That is a kidney problem. Everyone has dry skin. And you are right. Dry skin is extremely common, especially over 60. And most of the time, it has nothing to do with the kidneys. But there is a specific kind of dryness associated with kidney disease that is different in quality and in behavior from ordinary dry skin. And I want to teach you how to tell them apart. Ordinary dry skin, the kind caused by aging, low humidity, excessive bathing, or not drinking enough water, responds to moisturizer. You apply a good lotion, you do it consistently, and the skin improves. It may not become perfect, but it responds, gets better. Kidney-related skin dryness does not respond to moisturizer. You can apply the best moisturizer in the world twice a day, every day, and the dryness persists. This happens because the dryness is not caused by a lack of moisture in the surface layers of the skin. It is caused by changes in the sweat glands and sebaceous glands, the oil-producing glands in the skin that result from the accumulation of uremic toxins. Here's the mechanism. When uric toxins build up in the blood and reach the skin, they cause a condition called uremic frost in the most advanced stages, where ura actually crystallizes on the surface of the skin. But long before that extreme endpoint, the toxins interfere with the normal function of the skin's own moisture-regulating systems. The sebaceous glands produce less oil. The skin barrier becomes compromised. The skin loses its ability to hold water. Because the underlying problem is biochemical rather than environmental, no topical treatment addresses it. The areas most commonly affected are the lower legs, particularly the shins and the tops of the feet. The skin in these areas can become so dry that it cracks, bleeds, and becomes susceptible to infection. In some patients, a fine white powdery residue appears on the skin surface as ura leaches through. In others, the skin simply becomes rough, flaky, and almost leathery in texture despite constant moisturizing. The combination of persistent itching from sign 1 and the treatment-resistant dryness of sign 4 often appear together. And when they do appear together with no other obvious explanation in a person over 60, that combination is a powerful signal that deserves urgent kidney evaluation. I want to introduce you to one more patient. His name was Earl. Earl was 68 years old, a retired postal worker from Georgia. He had been dealing with what he called alligator skin on his shins for about 18 months. Rough, scaly, cracked skin that bled if he scratched it. He had tried every lotion his wife had brought home. Coconut oil, shea butter, prescription ura cream. Nothing touched it. When Earl eventually saw a nephrologist as part of a cardiovascular workup for high blood pressure, his GFR came back at 44, stage 3 chronic kidney disease. The first thing the nephrologist said when Earl showed him his shins was, "This is what I expected to find." He had seen those shins before on dozens of patients. Those shins were not a skin problem. They were a kidney problem that had been sitting there in plain sight for 18 months. Earl asked him why nobody had told him sooner. The doctor said, "Because nobody asked your kidneys." Now, I want to address something before we close because I know what some of you are thinking. You are thinking, I have one of these signs or maybe two, and now I am scared. And I want to speak to that directly because I think about this a lot as someone who communicates medical information. I do not share this information to frighten you into paralysis. I share it to move you toward action. There is a profound difference between fear that freezes and information that mobilizes. The goal of this video, from the very first word to this moment, has been the second one. Here is what I need you to take away from today. If you recognized yourself in any of these 4 signs, persistent itching with no rash, color changes in your skin, dark patches that will not respond to treatment, or dry, cracked skin that moisturizer cannot fix. The right response is not to panic. The right response is to pick up the phone tomorrow morning and call your doctor's office. When you call, use these specific words. I would like to have my kidney function tested. I want a GFR test and a creatinine level. You do not need to explain why. You do not need to justify the request. You are 60 years old or older, and having your kidney function checked is a completely appropriate and reasonable medical request. If your doctor pushes back, push back gently and firmly. Ask again. Your health is worth advocating for. If your results come back normal, wonderful. You have peace of mind and you have learned something valuable about your body. If your results show something that needs attention, you have caught it early. And early is everything with kidney disease. Early is the difference between managing and medicating. Early is the difference between lifestyle changes and dialysis. Early is the difference that changes the trajectory. Margaret, the retired school teacher from Ohio who scratched her arms for 2 years. She caught her kidney disease at stage 3. With the right dietary changes, medication management, and close monitoring, her kidney function has been stable for 4 years now. She has not needed dialysis. She has not needed to give up the life she loves. She calls her nephrologist every 3 months, brings her lab results, and she manages. Robert, the gentleman from Texas whose wife said he looked gray, he is also stable. His wife asks about his color every morning. He tells her she is the best kidney monitor he has ever had. He is not wrong. Dorothy, who spent 2 years treating a kidney problem as a dermatology problem, she is now in year 3 of a management plan that has slowed her disease progression significantly. She tells everyone she meets to look at their skin and ask the question nobody thought to ask her. And Earl with his alligator shins. Earl made dietary changes, brought his blood pressure under tight control, and his GFR has improved from 44 to 51 over the past 18 months. His skin has improved too, not perfectly but meaningfully, enough that he noticed, enough that his wife noticed. The skin tells the story. You just need to know how to read it. Save this video right now because the next time you notice something on your skin that you cannot explain, I want you to be able to come back here and check. Show it to a family member. Show it to someone you love who is over 60 because I can almost guarantee that someone in your life is experiencing one of these 4 signs right now and has no idea what it means. Subscribe to this channel and turn on the notification bell. Next week, I'm going to release a video that I think is going to be just as important as this one. The specific morning habits that nephrologists say are silently accelerating kidney decline in people over 60. Habits that seem harmless, habits that most doctors never think to ask about. You will not want to miss it. And please, right now, drop a comment below. Tell me how many of these 4 signs did you recognize? 1, 2, all 4? Type the number. I read every single comment and your answer might help me understand what the next video needs to cover for people just like you. Your kidneys have been quiet for a long time, but now you know what they have been trying to do.